My name is Cassie Meyer, and my proctors told me to begin at step 15 and end at step 23. So I have just completed hand hygiene and put on my clean gloves, and now Mr. Jones, I'm gonna let you know that there's complete privacy in the room. I've already pulled the drapes and shut the door, so when I expose your wound, no one will be able to see in here. So I'm gonna go ahead and take off your wound dressing. All right, Mr. Jones, I'm looking at the drainage for your wound, and the type of drainage is purulent, and the amount is scant, and the consistency is thin, the color is yellowy white, and the odor is none, so that is very good. And I'm gonna take out your inner gauze without touching the peri-wound area of the skin. And I'm going to look at the wound, and it's about 3 inches big, and there's no necrotic tissue, no slough, no odor, but there is slight granulation. And when I palpate the peri-wound area, tell me if there's any tenderness that you feel. I don't see any swelling or edema, and I also don't feel any tenderness. All right, Mr. Jones. Okay, now Mr. Jones, I'm gonna go ahead and set up my sterile field with my change tray. All right. Careful to only touch the outside 1-inch border because that is the contaminated portion. I'm going to dump my materials onto my tray without touching the middle and avoiding the sides. Okay, now I'm going to examine my saline solution, and the expiration date is not till October 2020, so we're good. And I'm going to go ahead and pour that. Slowly and without splashing onto my sterile field, and recap that. Now I'm going to put on my sterile gloves. Careful to only touch the 1-inch border because that is not considered sterile. Okay. Now I'm going to be touching skin to skin and glove to glove. And I'm going to keep my thumb up while slipping in 3 fingers into the gloved area. And I'm going to go ahead and put this on. Okay, only touching the outside of the gloves. Now that both my gloves are on, I can go ahead and adjust. Okay. Now I'm going to arrange the items on my sterile field. Dampen 1, 2, 3 gauze. And while those are getting wet, I'm going to examine your suture line, and the suture line seems to be intact. There seems to be no drainage, and it's about The suture line is about 5 inches wide and 1 inch in width. No, 5 inches long and 1 inch width. And it seems to be doing well. There's no reddening around the area, no drainage, and it seems to be healing well. Okay, Mr. Jones. All right, I'm going to take the gauze and I'm going to wipe from least contaminated to most contaminated, starting with the middle line of the suture. Gonna wring out the excess and wipe the most contaminated side, which is on one of the sides of the suture line. So I'm going to begin on the left and wipe down that. And lastly, I'm going to wipe down the right side of the suture line. All right. Okay, Mr. Jones, I'm going to go ahead and pat it dry with my sterile gauze just down the middle of the suture line. Okay, and that's the end of step 23.